The city of Southend-on-Sea has been a popular seaside resort for hundreds of years. It is famous for having the world's longest pleasure pier stretching over 2 kilometres into the sea. But in this election, it has gained attention for very different reasons, having some of England's longest waiting times for NHS treatment. The waiting list for routine hospital treatment is on the rise again in England, according to NHS figures. At the end of April, there were 7.57 million appointments on backlog. That's up 30,000 from the previous month. More than 300,000 people have been waiting for over a year. In Southend-on-Sea, 1 in 5 people are currently on a waiting list for routine treatment. Carol Crowhurst, a retired intensive care nurse, is one of them. For the last 10 months, she has been waiting to see a specialist to set a date for needed surgery.
My only concern is now whether on the 2nd of July, if the doctors decide to strike again, that appointment might get cancelled and then I might have to wait another 10 months for an appointment.
Working in A&E, Carol saw patients with long waits taking matters into their own hands.
They were waiting for a hip operation or a knee operation specifically, couldn't get pain-free, so they'd come to A&E as a last resort, really. It clogs it up with people who don't really need to be there.
Her husband Philip waited 2 years for knee surgery. He lost his job as a truck driver while he was waiting.
I used to have to jump in and out the trucks. I couldn't jump up, and if I did jump up, I used to fall out, and then in the end getting up the steps because the trucks are higher, and also driving them. I couldn't do the job, so they made me redundant.
When the day of his surgery came around, it was cancelled after a 12-hour wait and rescheduled 2 months later. Philip has recently been diagnosed with a neurological disorder and found himself on the waiting list again for routine checks on the condition.
You normally get a follow-up to go and see a doctor at the end of every year. But the last time it got cancelled and I waited about 7 or 8 months for another appointment, so it went on and on and on. If you're someone who's got it really, really bad, then something like that would have been a disaster for you.
Campaigners in Southend are keeping these issues in the spotlight in the election campaign.
In the election, people will be looking at who promises to invest in the NHS and who means it and what their plans are, but we'll be encouraging people to ask those questions. You know, what is your plan? How are you going to restore funding to the NHS? We've seen 14 years of cuts to pay for people in the health service, which is one of the main reasons why we're so short of staff. But of course, we've also seen 14 years of underfunding of the basic services.
We approached the Mid and South Essex NHS Foundation Trust about the long waiting times for patients. In a statement, Andrew Pike, Chief Operating Officer, said, "This is one of the largest trusts in the country. Patients are seen in order of clinical priority. We understand waiting for any treatment or surgery is always difficult and are sorry that some people have had to wait longer than we want them to." For Carol, Philip and many others in Southend, restoring their faith in the NHS is the key issue for the election and will be a key challenge for whoever leads the next government. Jen Copestake, CGTN, Southend-on-Sea.